Madame Safia came. She's looking for some restorations in some areas in her face. Madame Safia almost 47 years old, and she has done some deflations at her face. We agreed together that she needs to correct her tear trough, mid-cheek depressions, little at her nasolabial folds, and if we look closely as well, she needs little bit at her temples area. Madame Safia has as well some glabellar line and transverse lines at her forehead. Definitely this is for botulinum toxin job. And as we said, usually to restore the face, two approaches is better than one approach, so we are combining fillers with botulinum toxin. We will start with the cheeks. For the better correction, when we see the mid-cheek depressions and tear trough, it's better to start to correct it before correction of the nasolabial folds. Basically, the nasolabial folds comes from sliding of the buccal base of fat downward. It's not only losing of the volume in localized area. It's sliding the fat due to the gravity and aging. So, by correction of the mid-cheek depression and putting little bit at her zygoma, it will give her nicely lift. So, might be we need less amount of filler while we are correcting the nasolabial folds. It's very important as well while we are doing the procedures to make sure that it's done under complete aseptic precaution, and it's better to give some instruction to the patients before coming at the day of the treatment, like if they are using kind of vitamins or non-steroidal anti-inflammatory or whatsoever, because all of this stuff causing thinning of the blood. It's better to be stopped like 3 to 7 days before the procedures at all. We need also to highlight point when we are correcting the tear trough. It's better to give them idea that it might cause some bruises because this is a very highly vascular area. At least they don't have any vital commitments around the day of the injection. The good thing actually about the Radiesse, it's one of the biostimulant filler. That means that it's induced the collagen formation on the face, so it gives also nice skin texture as well. Actually, Radiesse is, for me, my favorite filler for many reasons. First of all, it's FDA approved, and so its safety margin is very high. Its longevity as well is very high. It reaches easily to more than 1 year, comparing by something like hyaluronic acid. The thing we need also to mention that there is some areas in the face which is Radiesse is contraindicated to inject it in it. Basically, lips, we are not able to inject Radiesse in the lips. In the glabellar area, here is this frowning line, and tear trough. So the upper part of tear trough, we need to do it by something like hyaluronic acid, but lower part and mid-cheek depression, it will be very good indications for the Radiesse filler. Here is the Radiesse syringe. It's 1.5. To let the patients more comfortable, it's better to mix it with lidocaine with adrenaline. We can mix it like 0.3, 0.5 of lidocaine with adrenaline with 1.5 Radiesse syringe. Here we are using basically a female-to-female cannula. We are connecting the syringe in one side. And here, this is the 3 ml syringe, which has almost 0.3 of lidocaine with adrenaline. It's a very easy process. So the only thing, just we need to push at the both sides between 15 to 20 times. the amount of the product almost 1.8, so it exceeds the volume of the syringe itself. So always there is a remaining on the 3 ml syringe. We can inject the amount first and then we come to refill the remaining and to inject it to the patient. The radius needle is a special needle. It's actually a very brilliant needle. The needle of the radius is 28 kg from outside and 27 from the inside. To be thinner, to be less traumatic to the patient, at the same time it's wider from the inside to give a chance to the products to flow smoothly. We're going to start to correct the middle cheek depressions at both sides here. There are many techniques for radius injection. Some physicians like to inject it by Paulus technique, which is putting a big amount of filler in one place and then they started to massage it. For me, I would prefer a fanning technique because it gives us a chance to spread nicely the products. At the same time, we're going to reduce the massage afterward to reduce the trauma. Radius should be placed very, very deep in the tissue, almost supraperiosteal. So here we go. Basically, we make the pedals of the needles downward. For detecting exactly where is the place of middle cheek depression, it's better to have view, front view and side view as well. It will look very obvious the place of middle cheek depression. The only point we need to highlight it here, we have to be very careful from the infraorbital vessels, which is located exactly at that point. We will try to make our entry points away from that point. We are going very deep, almost supraperiosteal. We can inject antegrade and retrograde as well. We are injecting very slowly. What I'm doing is fanning technique. Here my assistant is placing ice because actually ice is one of the best anesthetic, cryo anesthetic, and as well it makes the vessel constricted. Sometimes we need to check where is the tip of our needle to make sure that we are in right place. Just I will put little bit it over her zygoma to make a nice lifting for her lower face. From now you can see the difference in her face actually. Here it looks like lifted higher than the other. If you compare the one area it's already had been done and the other area you feel this one like lifted up. Now we're gonna start to inject the nasolabial fold. We are using the fanning technique as well. The thing about the nasolabial fold is that we need to be always medial. We are not always coming through the line and going medially. We are not able to inject laterally at all because if we did that, it will be a big mistake. It will give a volume and load over the nasolabial fold, which is create more depression. So we're gonna start. Also, we need to make it very deep, almost supraperiostral. It's nice to measure, to know where is the tip of your needle is going, and always the bevel is down. You can make it anti-grade and retrograde as well. Sometimes to correct the smiling fine line aside, we're going more lateral and we make it transverse. The corner is one of the weakest points of the face. Always we need to strengthen just by little amount of filler. So we almost done with the nasolabial fold. Usually with nasolabial folds, it's not nice to fill it completely because it will not look natural. So usually you have to consider the natural look of the patient. Can you look one side, please? enter the lens with your needle to see where you are going. We are going extremely deep. We can touch the bone even, and we go high. What I did actually, I make little bit withdraw to make sure that I am not inside the vessel, and then I put my polish or my filler. See guys, the face already had been lifted. With very minor procedure, it doesn't take, actually because we are talking and discussing, in the practice it doesn't need more than 7 to 10 minutes. So we'll start to do the same procedure on the other side. Again, we're gonna start to correct the lower part of the tear trough, mid-cheek depression, little bit in zygomal area. The injection should be very deep, supraperiostal, using fanning technique. We're always checking where is the tip of the needle. Change my needle. We change this needle.
Yes.
So we're done from the other cheeks, and we'll start to correct the nasolabial on other side. We're using the same technique, we just use it on other side. We are doing very deep supraperiosteal towards the middle. And we are injecting the retrograde. Again, we are stressing the corner of the mouth. What I was talking about, it's better for the radius to, when you put filler, we not over augment, because during touch up it's very easy to add some more, but if something more, we cannot erase it.
Just ask the security. Where's
After we end, we can apply little bit topical antibiotic as an antiseptic. We can use anything like Vectoropan cream or Fusidine cream, and we'll give instruction for the patients to follow a complete aseptic precaution, to be careful with her face. Usually with the cheeks, we are not giving advice like massage it. Once we distribute the material while we are injecting smoothly without any lumps, no need to tell them to massage to avoid any trauma. And we can tell them to use the Fusidine cream for a couple of days after the injection, and it would be good if we augment the cheeks to inform them at least first 1 or 2 days after the injection to sleep at their back, not on one side. Tell the material to be settled in the place. Usually the follow-up after 2 to 3 weeks to check if there is any touch-up needed to be done. We can do it at that time, and that's